These are the folks who teach us the absolute most about our environment and the conditions that we're treating, because it is amazing how sensitive this category can include of people, to the point where, and it's important to say that, you know, I'd say almost across the board, this is not a psychological and neuropsychological problem, maybe neurological, but not a psychological problem. This is the body responding in ways that are beyond what one would expect from a certain treatment. Those are the people that if you give them one drop of a fairly gentle detox reagent, that one drop can make them put them in bed for days or more. That's when we're taking one drop, putting it in water, and then we're taking out one drop of the 8-ounce glass of water with that one drop, and then trying that. And maybe even sometimes that's too much. Maybe starting on the wrist or the inner arm, or things that would normally be orally. So the sensitive group is I think that perhaps the newest group, but it's quickly becoming a large group of patients who we see, unfortunately. And I don't think that we all are really cognizant of all the possibilities of why this is happening, but it's happening. And I think that, I would submit that the the number of conditions that people are facing from a toxic, infectious, and infested load, and there is, the psychoneural immunology is a real field. The stressors that everyday life have upon us will affect our immune system. It will affect how our body reacts. But it's not just psychological. Again, it is how our cells respond to stress. Most of what our body tries to do is find ways to survive. I mean, maybe someone's talked about Bob Navio's approach or Isaac Elias's approach with some of these chemicals or pathways that are creating these survival strategies that, for the human body, when they're experiencing these survival strategies, make them much sicker. That autoimmune diseases may be related to cell danger responses, to the body trying to do the right thing, but overcompensating and ending up doing the wrong thing. So the sensitive group of patients are the folks who are feeling this at many different levels, and to different degrees. But those are the people who we can't just find a condition and treat it. We have to spend most of our time removing obstacles, making the conditions appropriate so we can actually do the business at hand. When we are removing obstacles, getting to what we really want to do sometimes, the nice thing is that just the fact of removing those obstacles by decreasing inflammation, by making the body more receptive to treatments, by nourishing the body, by just doing some of these things that make the conditions more appropriate for treatment, patients do get better. And so maybe people who've been sick for a really long time, they start feeling better before we've even really done what we think is the business at hand, before we've even done the full mold detox, before we've done the Babesia and Lyme and Mycoplasma and chlamydia pneumonia and Brucella treatment, before we've done any of that stuff, just by using things to let their body calm down and go, at a cellular level, sometimes that's all you need to at least get things started. They still have a ways to go, but sometimes the great thing, one of the greatest things about working with the really sensitive group is that a little treatment sometimes can make such an impact on their day-to-day life. It's quite rewarding.